to scale. Our institute this year is really working in the legislature. Make one political point here. You know, the Mental Health Services Act appropriates $500 million a year for prevention, early intervention, and innovation. And there are a lot of really good, promising practices, and I know a lot of the money is spent well, but there is no statewide thematic, strategic imperative about how we're going to spend that amount of money. And if we could get more services into schools, if we could get more help, I mean, there's so many parts of the story you can't tell in such a short period of time, but Jordana's grammar school and middle school was a K-8 before we sent her to Oregon and then Texas. They were great people, but they had no clue, and there were no resources of any kind in and around the school to maybe be able to help us with that shared decision making again, and maybe not, have been able to find a different pathway that wouldn't have resulted in our having to separate from our daughter for the formative years of her teenage life. And so we did the right thing, but nothing's easy.
I agree that they did the right thing. I want to make that clear. I think that the programs that I went to did save my life, and I credit that to my parents making that really difficult decision. And over the years, we've had discussions about what that meant for them and what that did really to them and my brother, and how difficult that was for both of us, for all of us. And I really do think that took a lot of strength on their part. And so I think that, yeah, as my dad said, we need to have more resources. But I think for what we had at the time, that was really remarkable for what they did. So as I mentioned before, despite the fact that there are pros and cons at these places, I do really respect the decision that they made.
Parallel lives, two perspectives. So I've had a political career, and I continue to have the privilege of serving the public, now as the mayor of the capital city. It's a very interesting job, different than being Senate president for sure, but public service is public service. And it's great, and people who hear our story, and one of the things, Deb Henderlew back here again comes from the Sacramento Bee. She was the editor who edited the story that a reporter named Cynthia Kraft did on Jordana that was front page in August of 2014. If you want to reference it, it sort of tells this story in more detail, and it was roundly received in a very positive way. But one of the things I remember, and sitting down with the reporter at the time, you know, after Jordana made the decision that she wanted to tell her story, was that it is really important for people to know that my interest in advocacy and mental health had nothing to do with this story we're telling. I got engaged, as Ellen said, in 1997 when Jordana was 3 years old. Almost three years old, when I was involved in this issue involving a lawsuit of the city suing this charity that was feeding homeless people, and I voted against it. And that was the moment I decided the underlying reason for homelessness is that Reagan and the legislature shut the state mental hospitals in the 60s and 70s, promised a decent system of community mental health care, never delivered. And I decided then, when she was 2.5, almost 3, that I was going to make mental health my cause in the legislature, because I was running for the legislature at the time. And I did. And in fact, when we passed Prop 63, the millionaires